Welcome to Comptracker, BCIT's secure method for tracking student progress. Over the next couple of minutes together, I hope to achieve the following. I will start by defining Comptracker, and we will show you how to locate all of their websites and the information that you will need to proceed. We're going to discuss the student's role in this process. I'm going to show you how to track your attendance, log your interesting cases. We'll discuss many of the forms that you're going to use in Term 1 and some of the forms that you will use in Terms 2 through 4. Finally, we will discuss the BCIT faculty progress forms. I will show you what those will look like. To get started, you will need to navigate to the main website. This can be found at www.studentlogbook.com. If you have done this correctly, it should have navigated you to Comptracker's main login page. Other useful web addresses include their support page and their training page. Let's take a look. Here you will find Comptracker's support page. If you are having any difficulties with your login or creation of forms, you can send an email to the support desk. Any emails to Comptracker support should be shared with Tammy so that she knows if there are any ongoing issues. Finally, we are on the training page. Here you will find many helpful tips for getting Comptracker to work optimally with any Apple device. Students will play a significant role in the feedback process. The forms are initiated by you. You will assign them to your clinical liaison. Please note that any item with an asterisk must be completed in order for you to submit the form. Students must be aware of the schedule and due dates. All of the due dates can be found on the faculty visit schedules as well as the D2L calendar. Assignment 2 for this course will involve creating a set of practice forms. You will be assigning them under Practice Rotation, and the CL will be Demo CL Nancy at Aberdeen. This assignment must be submitted by May 6th. Feedback is provided with one goal in mind: your success. You will have access to all comments by your clinical liaisons and BCIT faculty during the entire course of your training. This feedback is very important for your learning. Make sure that you do not miss out on an opportunity to gather feedback. Always review the feedback provided. Look for trends. Look at your strengths, and always think about areas for improvement. All of this feedback assures transparency. Any feedback should never come as a complete surprise. We discussed in a previous lecture which forms would be required in Term 1. So Term 1 has a very specific focus on integration into the hospital and an overall clinical orientation. Forms that will be used in this term and all subsequent terms include the site orientation checklist, a log of your attendance, the case log. In this case for Term 1, we will log 1 case per day, and finally a site evaluation. Forms that are specific to Term 1 only include a Term 1 general summary that will be due the Wednesday before the end of your overall general rotation. You will also complete a Term 1 summary for cardiac. This will be due the Wednesday before the end of your cardiac rotation. If you have not already done so, let's start by logging in. The web page again, www.studentlogbook.com. You will be asked to put in your institution ID, which is BCIT, your login ID, and PIN that was provided to you in the email from Comptracker. Now that everybody has had a chance to log in, I'm going to show you how to create a record. You will see on your screen the Create Record button, indicated by the arrow in red. To create your first record, go ahead and click Create Record. You'll see a drop-down menu. The first thing it will ask you to do is to choose a practicum. For the purpose of the assignment, you're going to choose a practice rotation. The next thing you have to indicate is the record type. You'll notice you can choose between attendance and forms. Let's go ahead and create our first form. From the drop-down menu provided, go ahead and choose the Site Orientation Checklist here. Once you've selected it, go ahead and click Create. So those steps again, click Create Record. First, choose the practicum. Second, choose the record type, and then click Create. Success! You've created your first form, and it should look something like this. You'll note now that we've selected the Site Orientation Checklist, the asterisk indicates that we must choose who this is assigned to. For purpose of the assignment, go ahead and select Nancy Chouinard as the preceptor. To complete this form, all you need to do is go ahead and click all of these areas here indicating that they've been covered. And finally, in Comptracker, two of the most important steps of this process is to go ahead and save as well as submit your form. Comptracker is also an easy tool to track student attendance. All absences must be entered on Comptracker. You will need to indicate the reason for your absence. Remember that any special leave days must be pre-approved by Tammy unless it is an emergency. That being said, all absences must be submitted to your clinical liaison. You should also use Comptracker as a tool to indicate any times that you are late, as well as any times that you are away for appointment. Your clinical liaison will approve these on a weekly basis. Let's go ahead and look at one. I'm going to go ahead and create an attendance record for student Jessica Alba. I'll go here to Create Record. The first thing I need to do again is choose my practicum. For purposes of the assignment, we will choose the practice rotation. Next, I need to choose the record type. In this case, it's attendance. I'll go ahead and create that. Next, I need to fill in the details. So let's assume that student Jessica Alba has been away ill for the entire day. So I will choose absent ill. Here I need to choose a preceptor or someone to assign the form to, as denoted by the asterisk. So I will go ahead and choose Demo CL Nancy. Next, I'm going to enter the details of the absence. So April 16th, the absence started at 8 a.m. It's a full clinical day, 8 hours, and the end time will be the end of her shift at 4 p.m. Now I'm going to go ahead and type in my name. Let's just say it's Jessica Alba. Then I can go ahead, sign and close, and that will submit the record. Next, we're going to talk about how you will enter cases into your case log. Comptracker has an app that can be downloaded onto an iPhone or Android phone. Cases can be logged during the day as you're going along and then synced at the end of the day. This may or may not be possible depending on your clinical site. Many clinical sites have rules and regulations in place for the use of mobile devices during work time and in the work area. The alternative will be that you will document these cases in a paper logbook to be entered into Comptracker at the end of the day. Just to recap, in Term 1, you will only be entering one case per day. In Terms 2 through 4, you will be entering all of your cases until your independent case goals numbers have been reached. To enter a case into Comptracker, you will need the following information. You will be asked to input the site from the drop-down menu, the date, the exam ID, and the exam type. You will be asked to score the difficulty of the case. Was the case easy? Would you put the case as average, or was the case actually very difficult? You will also be asked to indicate your level of involvement. Did you mostly observe? Did you scan less than 50% of the case? Did you scan more than 50% of the case? or did you scan the case independently? Next, you'll be asked to include some case details. Was the case normal or was there some pathology? Then you'll be asked to fill in a few details about the pathology seen. Remember that you should keep this brief. Let's go ahead and create a case log. So once again, you're going to create a record. You're going to choose the practice rotation, and under forms, you're going to choose case log details. You should have arrived at this screen for case log details. Here is where you can input the date, exam ID, the site, the exam type, the level of difficulty, your level of participation, as well as any interesting facts about the case. Comptracker will keep count of your number of cases. This number can be found on the main page under Forms and will tell you how many cases you've done, how many have been approved, and how many are remaining. Just a note, please ignore any cases that are in pending. I have navigated here to student Jessica Alba's main page, and you'll see under case log details that she actually has no information here. Once you've completed your first round of clinical, you should have at least 30 cases living here. A summary of your cases can be found on the reports page. This is actually a very easy and quick reference for us here at BCIT, so we can see how many cases have you been involved in, how many are independent, is there any area of practice that you need more exposure to. This also helps Tammy to create your clinical rotations. The Reports tab is located just up here along this edge in the middle. You can click here to generate any of the reports seen on the previous slide. A general summary of your core and scanning skills will be submitted at the end of 4 weeks of general scanning. The timing will vary between students depending on your rotation. If you finish the term in cardiac, this form should be submitted at the end of week 4. Try to generate this form by Wednesday of your last week. This form takes a little bit more time for your clinical liaison to complete. Let's take a look. I'm going to go ahead and create a general Term 1 summary for my student Jessica Alba. As with every other form, I'm going into Create Record. For our purposes for the assignment, I will choose the practice rotation, and under Record Type, I'll choose Forms. Next, from the drop-down menu, I'm going to select Term 1 General and create the form. Of course, I will need to assign the practicum as well as a CL. From the drop-down menu, I'm going to choose Demo CL Nancy for the assignment purposes. I need to put in the date, and I'm also going to select the site. In this case, we will choose Aberdeen. The student will do a self-assessment of their skills in several core and scanning categories. They will mark themselves as below expectations, needs attention, meets expectations, or exceeds expectations. The clinical liaison will comment on the student's progress directly below. After the student has self-assessed, they will have an opportunity at the bottom of the form here to input any comments about how things have gone. The clinical liaison will do the same. Once we've had a look at this, BCIT will rate the student as meeting targets and put in some comments of our own. Similarly, you will fill out a Term 1 summary after your 2 weeks spent in cardiac. The skills are listed. The expectations are basic. You will notice that the Term 1 cardiac form is quite a bit shorter than the general form. As I scroll down, you'll see you will do a self-assessment of core skills. You will be rated on your knowledge and an overall rating of performance. As I mentioned before, targets remain low. You're going to be looking mainly at the parasternal long axis and short axis. Finally, you will have an opportunity to put in some comments, as well as the clinical liaison, and at the end of the day, BCIT will fill out this portion as well. Finally, at the end of your clinical rotation, you will be asked to fill out a clinical site evaluation. These should be completed by each student for each site that you attend. Remember that the clinical site evaluation should be assigned to Tammy, not your clinical liaison. Just a reminder, these evaluations are confidential. We will compile the data from all the students who have attended that site and send that out only after you have graduated. The feedback you provide helps the sites to improve the student experience. Please give kudos to anybody who has gone out of their way to make your experience successful. And if you have constructive ways that the site can improve, please provide that as well. If you assign your site evaluation to your CL, well, let's just say I'll be very disappointed. The clinical site evaluation form can be created in the same way that all of the other forms have been created. Under Create Record, choose Forms, and you will see here Clinical Site Evaluation. Again, you must fill in anything noted by an asterisk. And then there are some questions asking you about the case types, your clinical liaison, the staff sonographers, and the radiologist if applicable. Once again, we ask you to fill this out honestly and provide us with some constructive feedback. We've devoted most of our time so far to talking about what will happen in Clinical 1. Next, I want to move on to talk about what needs to be done in terms 2 through 4. You guessed it, more forms. So in addition to some of the forms that we've already discussed, you will have some additional forms. They include weekly or bi-weekly progress forms. You may be asked to fill out a midpoint skills form, including a core and scanning portion. You will be asked to fill out end summary forms, and in addition, you will see what a BCIT faculty form looks like. We'll start by covering the weekly progress summaries. These used to be done weekly, but we found that this was just a little bit too overwhelming. They've been reduced to being filled out every 2 weeks. The student is responsible for creating this form. You will be asked to answer 4 questions. Again, you want to be brief. Do not fill it with more information than the size of the box. This definitely provides us with a summary of how things are going. This should be submitted to the CL. The CL will score your skills in a number of areas. Let's take a look at one. This form will be created in the usual way. Once again, you will need to assign this to your CL, noted here by the asterisks, put in the date and the site. Then you're going to be asked to reflect on these 4 guiding questions. Key things that I learned this week. Some of the challenges that I experienced. What are my goals for next week? And how am I going to get there? The biweekly progress form is used as a way to check in with students. It is formative feedback, which allows the student to improve. You will be rated by the CL as either progressing well or needs attention, and you'll be rated in the following categories: communication, professional conduct, patient care, ergonomics, instrumentation, overall scanning skills, didactic knowledge, integration and problem solving, as well as consistency of performance. Remember that needs attention means just that. It needs your attention. It's something for you to focus on. You will have an opportunity to fill in some overall comments about how the last 2 weeks has been, as well as the clinical liaison. Helpful hint: always save as you go. There is nothing more frustrating than losing the stuff that you have already written. You can save at any time and submit when you are completely finished. There are midpoint skills forms that you may be asked to complete if your skills need attention or are below expectations. These will be done upon program request only. We ask that you score yourself realistically in all areas. It is okay to need attention. Needs attention is just that. It's something for you to focus on. Comments on this form are very helpful. This helps us design a plan to help you succeed. A summary comment on this form is required. If you are asked to complete a midpoint summary form, you will see that there are two sections. You must complete a midpoint skills core form as well as one other. This may be a cardiac form if you're in a cardiac rotation, a general form if you're in a general rotation, or a BC Women's form if you're in an OB rotation. Let's take a look at the general form. The general form covers the skills in multiple different areas, to include imaging instrumentation, as well as scanning skills in various areas such as abdomen, thyroid, gynae, OB, and vascular. I'll let you have a look at this form a little more closely on your own time. The core skills as they relate to sonography are skills that are common to all exam types. So the second form you'll fill out will be the midpoint skills core. This will include areas such as communication, your professionalism, initiative and organization, patient care, ergonomics, pathology identification, your knowledge base, your integration of skills, and finally, some summary comments. As I said before, a summary comment is required. At the end of each rotation, every student will be asked to complete an end summary form. This will be submitted at some point in your last week. I usually suggest that you complete it by Wednesday so the CL has some time to complete it. This form is a combination of your core and scanning skills. Comments should be included if you're not meeting targets. A summary comment is always helpful. These are a bit more time-consuming for the CLs to complete, so submit them early. Scanning skills in each exam category are scored. Here's an example of a general end-term summary. You will notice on the form that you will start by self-assessing your general core skills. Core skills are rated on the following scale. They range from below expectations to exceeds expectations. Most of you will be meeting expectations. The top part of the form covers the core skills. Once you have rated yourself and your core skills, the form goes more specifically into general scanning skills. You will see that scanning skills are rated on the following scale, from a 0 to a 6. Most of you will enter clinical practice around a level 3, where you can perform the skills satisfactorily on an easy or normal patient. Your goal in clinical will be to build these skills through a level 4, which are more difficult patients, and then up to a level 5, where you are competent or entry level. Very few of you will achieve a proficient status, as this takes time and experience as a general tech. In this section of the form, you will be rating the various scan types on this scale of 1 to 6, such as abdomen, renal and bladder, thyroid, scrotal skills, breast skills, gynae skills, and all the way through OB and vascular. This is a major check-in to see how you're doing at the end of each rotation. I encourage you once again to write plenty of comments along the way, specifically if you're struggling in any area. There is one final form to discuss, and that's the BCIT Faculty Progress Form. Once you've completed Level 1 Clinical, in rotations 2 through 4, faculty from BCIT will be coming out to visit you in your clinical sites. This is a form that is actually generated by the faculty, not by you. It will summarize your overall performance, and I always like to include scanning tips and tricks or interesting things that we've discussed. This will indicate very clearly whether you are meeting targets for that rotation. These will be some of your best clinical days. So, just to recap, you now know how to access Comptracker. We've discussed your role in the feedback process. I've shown you how to create records and run reports using Comptracker. And you now know which forms to fill out and when, and also who to assign them to. You are now ready to complete assignment 2, which is located on D2L and due on May 6th.